my name is Kayla Facundus, and I'm a FNP student at Maryville University, and you're about to view my head-to-toe assessment. This is my patient, Ben. Prior to getting started, I had him empty his bladder, change into a hospital gown. I obtained a set of vital signs. I got his height and weight. I tested his distance vision using the Snellen chart, and I tested his near vision using the Rosenbaum chart, and both of those assessed cranial nerve 2. Upon inspection, I can see that Ben is not in any acute distress. His skin is uniform in color. His posture is within normal limits. I can't see any abnormalities at this time. So now I'm going to move to assessing his head and face. Upon inspection of his head, I see that it's normocephalic. I don't see any obvious deformities or masses. His eyes are symmetrical, his ears are symmetrical and aligned. And now I'm going to move to palpate his head. Upon palpating his head, I don't feel any masses or any knots. Are you tender?
No.
Okay. And I see that his hair is evenly distributed. It's brown in color and shiny and smooth. Now I'm going to assess his jaw for TMJ, his temporomandibular joint. Can you open your mouth and close it a few times? Okay, no crepitus is noted. Was that tender for you?
No.
Okay, so that's within normal limits, no abnormality there. I'm also going to assess his facial bones. Does that hurt? Any tenderness?
No.
Okay. Now I'm going to move into assessing his sinuses. I'm first going to assess his frontal sinus. Any pain or pressure?
No.
Now I'm going to assess his maxillary. Any pain or pressure?
No.
I didn't feel any masses. He didn't have any pain with that. So now I'm going to move into testing his sense of feeling something soft. So if you can close your eyes, I'm going to brush your face with something and tell me where you feel it.
Forehead, right cheek, chin, left cheek.
Okay? Now if you can open up your eyes and look at me, I'm going to have you clench your teeth, smile, raise your eyebrows, stick out your tongue, puff out your cheeks. Alright, all of that seems to be within normal limits. Also wrinkle your forehead. Alright, so cranial nerve 5 and 7 after conducting those tests are within normal limits. So now that's going to take me to his eyes. So first I'm going to inspect them. When I inspect them, I see that they're symmetrical. He has his eyelashes curve outward. His sclera is white. His eyebrow hair is distributed evenly and extends with his eyes. I'll palpate his lacrimal apparatus. I don't feel any nodules. There was no tenderness with that, was there?
No.
There was no drainage from that. And also, keep your eyes open for me. His conjunctiva, you know what I'm trying to say, are pink and moist. And now I'm going to assess his eyes with my pen light for pupillary response. So if you could just look straight ahead for me. Direct, indirect. Direct, indirect. From that test, I established that his eyes, his pupils are equal, reactive, round to light and accommodation, and they're also consensual. So now we're going to perform the cover-uncover test. So I'm going to have you look straight ahead, and I'm going to cover one of your eyes and just keep looking straight ahead at that picture over there. All right, now I'm going to do your other one. Nose strabismus is noted. Now I'm going to assess his extraocular eye movement by having him follow my pen light through the 6 cardinal fields of gaze. So if you'll just follow my pen light with only your eyes. Very good. So by assessing that, I established that his cranial nerve 3, 4, and 6 are intact. He didn't have any nystagmus or extraocular eye movements with that. Now I'm going to take my ophthalmoscope and I'm going to assess his eyes for a red reflex. Alright, so I'm going to have you just look straight ahead still for me. I noted a red reflex in that eye. Now I'm going to look at this one. Had a red reflex in that. I didn't see any redness or bloodshotness or anything like that. So now I am going to move into assessing Ben's ears. Upon inspection, I find that they are aligned evenly, they're symmetrical. I don't see any redness. The color is uniform. The ears are uniform in color, they're pink. I am first going to palpate his auricle for any tenderness. Let me know if you have any tenderness. Any tenderness?
No.
After palpating his ears, I found there was no tenderness. They were pink, warm, and dry. Now I'm going to conduct the whisper test. So what I'm going to do, Ben, is I'm going to have you stick your include your left ear while I whisper something over here and tell me what you hear me say. Baseball.
Baseball.
All right, we're going to do the same with the other ear. Puppy.
Puppy.
Okay, very good. You passed that test. So now we are going to test his hearing with the Weber and Renee test using my tuning fork. So I'm gonna sit this on top of your head and tell me if you can hear the sound equally in both ears. Can you hear it in both ears?
Yes.
Okay. You could hear it in both ears, so there was no lateralization. Now I'm going to conduct the Renee test. I'm going to stick this behind your ear. Tell me when you can no longer hear it.
No.
Okay, now tell me when you can no longer hear it.
No.
Okay. That shows that air conduction is greater than bone conduction. I would normally do the other ear, but for time purposes in this video, I'm just going to do the right ear. So cranial nerve 8 is intact. So now I'm going to assess his ears with my otoscope. All right, Ben, if you'll let me just take a quick look. If you could turn your head that way for me. Alrighty. Now this ear. Okay, I didn't see any drainage. His tympanic membrane was pearly gray with a good cone of light. No redness, anything like that. So now I'm going to move on to his nose. Upon inspection, I see that his nose is symmetrical. His septum doesn't look deviated. Can you occlude one of your nostrils and take a deep breath? Okay, good. Do the other one for me. So both nares are patent. His nose is midline. Now I'm going to take my otoscope to view inside of his nose. Okay, if you could look up for me. Alright, didn't see any redness or drainage, no lesions. So his nose looked good. His septum, like I said, was midline. And now we established patency. And earlier we tested his cranial nerve 1. I got him to smell a couple of familiar household items, a lemon and vinegar, and he was able to differentiate between the two. So cranial nerve 1 was intact. Now, I'm going to move on to the mouth and throat. So upon inspection, his mouth looks symmetrical, it's pink, there's no crack into his lips. I am going to assess his gums. So if you let me. Okay, I didn't see any bleeding or swelling to his gums. I'm going to take my pen light and check out what's going on inside his mouth. You can stick your tongue out for me. Say ah. Alright. Can you stick your tongue out again? Can you move it up, down, side to side? Now I want you to press up against my thumb. Very good. My other one. Alright, and stick your tongue back out. I'm going to assess your gag reflex. Okay. His gag reflex is intact. His tongue was able to move up and down. When I palpated his cheek, he was able to put pressure against my fingers. So that all proved that cranial nerves 10 and 12 were intact. When I checked inside of his mouth, his uvula was midline. It raised with his soft palate. When he did the eye test, his gag reflex was in place, and I didn't see any lesions on his tongue or on his mucous membranes. So also I tested cranial nerve, cranial nerve 8, I believe, is the taste, for something salty, and no, 9. Wait, I'm sorry. I apologize. Cranial nerve 9 to see if he could establish sweet and sour, and he passed. So now I'm going to move on to the neck. First, upon inspection, I'm going to take a look at his neck. It looks uniform in color. I don't see any swelling, any thyromegaly, no JVD. Can you swallow for me? When he swallowed, I could see his throat move up and down like it's supposed to, and everything is symmetrical. So now I'm going to test range of motion. So if you could look up, look down, put your ear to your shoulder, do the same to the other one. Alright, push against my hand. Very good. Push against my other one. Alright, and then shrug your shoulders. Okay, after doing all those tests, I established that his range of motion is intact, which with his neck, which shows that cranial nerve 11 is intact. So now I'm going to palpate his neck. First, I'm going to start by palpating his carotid pulses one at a time. Okay. Alright, they're equal, they're not bounding, they're about +2. And now I'm going to assess his trachea. It is midline. I'm also going to palpate his thyroid. If you could look up for me. Would you swallow? Alright, I didn't feel any nodules. No, it wasn't no thyromegaly. His trachea was midline, and that's it with that. So now I'm going to move on to palpating Ben's lymph nodes. First, I'm going to start with the occipital, and then I'm going to move to the post-auricle, the pre-auricle, the submandibular. Any tenderness?
No.
submental, the tonsillar, the superficial cervical, the posterior cervical, and the deep cervical. Also going to go a little further down and palpate his palpate his supraclavicular, his infraclavicular, and if you could lift your arms out for me, and his axillary. Most of the nodes weren't palpable. The ones that were soft and mobile. He didn't have any tenderness with them, and I didn't have any nodules. So now I'm going to take my stethoscope, listen with the bell part to his carotids and then his thyroid. Take a deep breath. And let out. All right. Do it again. All right. Okay, upon auscultating his carotids and his thyroid, there were no bruits to be found. So now I'm going to have Ben turn, no, not turn yet. I'm gonna check out Ben's upper extremities. Upon looking at his arms, they look like they have good color to them. Hair is distributed evenly. Can you hold your arms out for me? Can you turn them over? All right, very good. I'm going to palpate for muscle mass. Any tenderness?
No.
There's no joint redness or tenderness. Muscle mass is symmetrical. Can you squeeze my hands for me lightly? Okay, grips are even, and they're 5 out of 5. I'm also going to look at his fingernails. Capillary refill is less than 2 seconds. There's no ridges noted in his nails. Okay, can you bend your elbow? Okay, very good. Okay, range of motion seems to be pretty good in his arms, and now I'm going to palpate for his radial pulses, and now his brachial ones. In both sets of pulses, they were strong, equal, +2. Now we're going to move to Ben's back. So Ben, if you wouldn't mind flipping around here. Okay. Upon looking at Ben's back, I don't see any deformities. It's uniform in color. I think I'm off the camera. It's uniform in color. I'm going to palpate his scapula, cervical spine. Any tenderness?
No.
Respirations don't look labored. And I'm going to percuss over his costo-vertebral angle to see any tenderness. Any tenderness?
No.
Okay, no tenderness. Now I'm going to do tactile fremitus. So whenever you feel my palms touch your back, say 99.
99. 99. 99. 99.
All right, tactile fremitus was normal. Respirations appeared to be even and unlabored. Now I'm going to percuss his back. I should hear resonance over lung sounds. I should have used the ladder approach where I went back and forth. But for time purposes, at least I know that I was supposed to do that. Right, and now I'm going to check for his diaphragmatic excursion. Take a deep breath. All right, let out. All right, my thumbs raised together. His excursion looks equal. I didn't feel any type of crepitus or anything like that. And now I'm going to check for diaphragmatic excursion. The other thing was thoracic expansion. It wasn't diaphragmatic excursion. Now I'm going to assess for diaphragmatic excursion. So I'm going to start up here, and I'm going to percuss down until I hear dullness. So Ben, if you could take a deep breath and hold it. All right, I noted dullness to be right about here. So now, if you could let out your breath and then take a few more breaths. Mark it with my pen. All right, and now I'm going to percuss up again, or no, down, I'm sorry. I mean up again, down. All right, and that's where your dullness there. When I measure it, I get 5 or 6, which is normal. And now I'm going to auscultate Ben's back, his breath sounds. Whenever you feel my stethoscope, take a breath in and out. Okay, breath sounds were clear, bilateral, and now we are going to move on to the front of Ben's chest. So if you want to sit back on the table and pull your gown down. Upon inspection, Ben's chest hair is distributed evenly. He doesn't appear to be in any distress. His respirations are even and unlabored. I'm going to palpate his precordium. Alright, I did not feel any thrills or heaves. Now I'm going to assess his front for tactile firmness. Do the 99 every time you feel my palms.
99, 99, 99.
Okay. Tactile firmness was noted to be normal, and now I'm going to auscultate his breath sounds in the front. Whenever you feel my stethoscope, take a breath in and out. All right, lift your arms out. Both laterally and anteriorly, his breath sounds were clear. Now I'm going to auscultate his heart sounds. First, I'm going to start with the aortic. Pulmonic. Herb. Tricuspid, and his mitral, which is also the point of maximal impulse. They were audible in all parts, S1, S2, no extra heart sounds, no murmurs, anything like that. So now I'm going to move on to Ben's abdomen. So if you could lay back for me. We got to get this going. Upon inspection, Ben's abdomen does not have any scars. It is even in color. His hair is distributed evenly. I am going to now, I don't see any thrills either. So now I'm going to auscultate in all 4 of his abdominal quads. Okay, there was active bowel sounds in all 4 quads. Now I'm going to take the bell of my the bell of my stethoscope and listen to the different abdominal arteries. So first I'm gonna start with the aortic, iliac, renal. This is renal. Iliac, and now femoral. No thrills were noted. No bruits were noted. And now I'm going to percuss in all the quads. I should hear tympani, which I do. So now I'm going to palpate for the liver border. So I'm along his mid clavicular line. I'm going to start percussing upwards. Right, I noted it to be dull there. And now I am going, if you could hold your breath again and let out. And now I'm going to percuss back up. Now, from this point to this point, it measures to be about 5 to 6 centimeters. Also, I'm going to palpate his spleen. No dullness noted. And now percuss his spleen. And now I'm going to do light palpation in all the quads. Tell me if you feel any tenderness. Right now I'm going to do deep palpation. Tell me if you feel any tenderness. No masses or tenderness noted. Now I'm going to palpate the liver border. Spleen border. The right kidney. Left kidney. And the aortic. Any tenderness with any of those?
Nope.
Okay. And now can you stick your head up? Right? His abdominal muscles, when I look at them, they're smooth. There's no abnormalities noted, and I don't note any hernias. So now we're going to move to his feet and legs. Hurry. Well, he could have stayed laying down too, but while I'm looking at his legs, they seem uniform in color. Hair is distributed evenly. I don't note any edema. Warm and dry. Can you stick your feet down, up, side to side? Okay. His feet and his legs have normal range of motion. They look symmetrical, good in color. I'm going to palpate his pulses. Posterior tibial is present, popliteal is present, and his dorsalis pedis is present, as it is in the other legs, but for time purposes. And now we are going to test him for dullness, if he can test sensation with dullness. So this is sharp and this is dull. Close your eyes for me.
Sharp. Dull. Sharp. Dull. Sharp.
Okay, he's able to sense sharp and dull sensation. And now if you could stand up for me. Oh, no, don't stand up just yet. New deep tendon reflexes. The knee. All right. Brachial. Brachial. All right. And now his Achilles. All right. All those, were plus, +2, they were intact. And now if you could stand up so I could assess your spine, stand. I assessed his cervical earlier, now I'm gonna look at his lumbar. Can you bend forward? Okay. Can you bend back? Very good. Side to side. Now twist for me. Any pain?
No.
Okay, and if you could take a few steps over there, just walk forward. All right, Ben's gait seems to be steady and he's coordinated, and I believe this concludes my examination. Thank you.